Hello everyone, welcome to ANAT AV. This video includes a brief insight of the foramina in the skull base and the structures passing through them. First, let's identify the foramina in the anterior cranial fossa. The cribriform plate of the ethmoidal bone is perforated by numerous foramina for the passage of olfactory nerve rootlets. The anterior ethmoidal canal transmits the corresponding nerves and vessels. The posterior ethmoidal canal transmits the vessels of the same name. Note that the posterior ethmoidal nerve does not pass through the canal as it terminates earlier. The superior orbital fissure formed between the margins of the greater and lesser wings of the sphenoid bone consists of three parts that transmit the following structures. The lateral part transmits the lacrimal nerve, frontal nerve, trochlear nerve, and the superior ophthalmic vein. The middle part transmits the upper and lower divisions of the oculomotor nerve, nasociliary nerve in between the two divisions of the oculomotor, and the abducens nerve infralateral to the foregoing nerves. The middle part transmits the inferior ophthalmic vein and the sympathetic nerves from the plexus around the internal carotid artery.
Let's move on to the foramina in the middle cranial fossa. The foramen rotundum transmits the maxillary nerve. The optic canal transmits the optic nerve and the ophthalmic artery. The foramen ovale transmits the mandibular nerve, the accessory meningeal artery, the lesser petrosal nerve, an emissary vein connecting the cavernous sinus with the pterygoid plexus of veins, occasionally anterior trunk of middle meningeal vein. These structures can be easily remembered using the mnemonic MALE, M-A-L-E. The foramen spinosum transmits the middle meningeal artery, meningeal branch of the mandibular nerve or nervus spinosus, and the posterior trunk of middle meningeal vein. The carotid canal transmits the internal carotid artery and the venous sympathetic plexus around the artery. The foramen lacerum. No significant structures passes through the whole length of the canal except for the meningeal branch of the ascending pharyngeal artery and emissary vein from the cavernous sinus. However, the upper part of the foramen is traversed by the internal carotid artery with venous and sympathetic plexus around it. In the anterior part of the foramen, the greater petrosal nerve unites with the deep petrosal nerve to form the nerve of pterygoid canal or the Vidian nerves, which leaves the foramen by entering the pterygoid canal in the anterior wall of the foramen lacerum.
Now let's move on to the posteriormost part of the skull base, which is the posterior cranial fossa. The foramen magnum, which is centrally located, transmits the following structures. Through the narrow anterior part runs the apical ligament of the dens, vertical band of the cruciate ligament, and membrana tectoria. Through wider posterior part travels the lowest part of the medulla oblongata and the three meninges. Through the subarachnoid space runs the spinal accessory nerve, vertebral arteries, sympathetic plexus around the vertebral arteries, posterior spinal arteries, and the anterior spinal artery. The hypoglossal or anterior condylar canal transmits the hypoglossal nerve, the meningeal branch of the ascending pharyngeal artery, and an emissary vein connecting the sigmoid sinus with the internal jugular vein. The posterior condylar canal transmits an emissary vein connecting the sigmoid sinus with the suboccipital venous plexus. The internal acoustic meatus transmits the 7th and 8th cranial nerves and the labyrinthine vessels. The jugular foramen transmits the following structures. Through the anterior part, the inferior petrosal sinus and the meningeal branch of the ascending pharyngeal artery. Through the middle part, 9th, 10th and 11 cranial nerves. Through the posterior parts, internal jugular vein and meningeal branch of the occipital artery.
Then, the outer surface of the skull base. First, the stylomastoid foramen transmits the facial nerve and the stylomastoid branch of the posterior auricular artery. The lower surface of the upper palate, the incisive foramen, is a deep fossa situated anteriorly in the median plane. Each incisive foramen transmits the terminal part of the greater palatine vessel from palate to the nose and the terminal part of the nasopalatine nerve from nose to the palate. The greater palatine foramen, one on each side, is situated just behind the lateral part of the palatomaxillary suture. The greater palatine foramen transmit the greater palatine vessel and the anterior palatine nerve, both of which runs forwards in the groove that passes forwards from the foramen. The lesser palatine foramina transmits the middle and posterior palatine nerves.
That brings this video on foramina of the skull to an end. If you enjoyed this video and found it helpful, don't forget to like, comment and subscribe. Please share this video with your friends and anyone interested in the study of anatomy. Thank you for watching ANAT AV.